Dr. Jennifer Thompson, a maternal fetal medicine specialist at Vanderbilt, and I'm here today to talk to you about pregnancy in a pandemic. I do apologize for the technical difficulties. The PowerPoint wasn't really important, just a guide to kind of follow us through things. So we'll go through that and talk about what we're going to do managing a pregnancy during a pandemic. We realize that COVID-19 has created many challenges throughout life, and of course, this impacts your pregnancy, but we don't want this to diminish this exciting and special time for you and your family. Today, I'm going to address some of your questions and concerns regarding pregnancy during a pandemic. My goals during our talk today are to discuss the severity of COVID-19 in pregnancy, discuss what you can do to keep yourself and your baby as safe as possible, discuss what we're doing as healthcare providers, and particularly at our institution, Vanderbilt University Medical Center, to ensure you and your baby's safety, and to address any questions that you may have. Please use the chat feature as to type in your questions, and we'll get to those at the end. So let's get started. Are pregnant women at increased risk of getting COVID-19? I think that this is a question that many women ask and are concerned about, especially as we see the increasing numbers of positive cases, especially over the last week. We know that pregnant women have increased susceptibility in other respiratory illnesses, such as influenza. And to this point, pregnant women generally do not have an increased risk of getting COVID-19. However, as we'll talk about a little bit later this morning, there does appear to be an increased risk of disease severity among those women who do end up getting COVID-19 and are pregnant compared to non-pregnant individuals. The majority of infected women, however, do recover without undergoing delivery and in general have more asymptomatic or mild cases. However, we will talk about the increased risk of disease severity and what that looks like. So what are the symptoms of COVID-19? We know that as we've learned more about this disease, more and more symptoms have been coming out as markers for COVID-19. And sometimes it's challenging to determine which of these symptoms are associated with me developing COVID versus what are these symptoms as far as normal pregnancy findings or even findings of other kind of diseases. So we're going to go through those symptoms and talk about what we tend to see most often in pregnant women when they develop COVID-19. Symptoms that we tend to see include fever or chills. If you experience new onset fever, and that's defined as, an elevated temperature, typically greater than 100 degrees Fahrenheit, we would recommend that you seek medical care to get evaluated. Cough, new onset cough. This can sometimes be challenging to determine, is this related to COVID or is this related to some other illness? But when we look at pregnant women tend to more often report cough as one of their first symptoms than some of the others that we're going to discuss here shortly. So if you do find that you have development of a new cough, it would be worthwhile to reach out to your healthcare providers. Shortness of breath. This one's very hard to kind of tease out sometimes. Is this pregnancy related or is it related to COVID? When we think of shortness of breath, we know that as pregnancy progresses, women kind of experience increased shortness of breath. However, they should never have difficulty breathing. Women who are experiencing difficulty breathing or having a really hard time catching their breath or working hard to breathe, that is never considered normal in pregnancy. And if you ever develop symptoms like that, it is important to get further evaluation. We do know that women, as they progress in pregnancy, often have to take kind of more breaths within a minute, and that they may need to rest to kind of catch their breath, but this should never be something that's increased work of breathing. One of the next symptoms that's described is fatigue. That's another one that's hard to tease out COVID versus pregnancy. We know that pregnant women are tired. All of us are tired, especially if you're busy running around all day. It's hard to know, is this fatigue that I'm experiencing associated with an illness, or is this just normal changes of pregnancy? If you ever have questions or concerns or aren't certain if what you're experiencing is normal, it's really important to let your provider know. Muscle or body aches. This refers to kind of those all over aches and pains that we get when we get illnesses such as a cold or maybe the flu. This has also been seen as one of the more frequent signs that has been reported among pregnant women as the symptoms that they develop. Headache is another symptom associated with COVID, and headaches have a variety of diseases associated with them throughout the course of pregnancy. New onset headaches in the third trimester, if you don't have a history of headaches, or if you haven't had headaches at all throughout the pregnancy, are worthwhile to reach out to your provider because it's important to know, is this related to some kind of disease that can be associated with pregnancy, not just COVID? And so new onset headaches are important to get evaluated. I'm sure we've all heard about the loss of smell or taste that's associated with COVID. This has been reported less frequently among pregnant women. In a recent study, approximately 6% of pregnant women found that new loss of smell or taste was the first symptom that presented. Sore throat, this can also be hard to tease out. It can be associated with multiple different illnesses, but was again a symptom that was more commonly reported as one of the first signs of COVID in women who ultimately developed it. Congestion or runny nose. Living here in Middle Tennessee, we know that seasonal allergies can be especially difficult both in the spring and fall. Sometimes that can be hard to tease out what these symptoms are related to, but that is also a symptom of COVID. Nausea and vomiting, again, a hard one in pregnancy, especially in the first trimester. Is this morning sickness or is this signs of COVID? If you're uncertain or just concerned, it's really important, again, to kind of touch base with your providers and see if this is something that they suggest testing for or not. And then last but not least is new onset diarrhea. Obviously, that could be related to other things, but has been seen as far as a symptom associated with COVID. Looking at a nationwide study of pregnant women who were ultimately diagnosed with COVID-19, either during pregnancy or in the postpartum period, found that pregnant women most often report cough, as I mentioned, approximately 20%, 16% reported sore throat, and 12% reported body aches. Fever was an uncommon finding, with that being reported in only 12% of the pregnant population that was diagnosed with COVID in this study. In terms of how long symptoms last once someone is diagnosed with COVID, symptoms often persist for several weeks. Approximately 60% of women will report resolution of symptoms by 4 weeks after initial diagnosis. However, in up to 25%, symptoms will persist up to 8 weeks. Now that we've discussed kind of the different symptoms associated with COVID, when should someone go and get a COVID test? The CDC recommends COVID testing if you have symptoms, if you have a household contact who tests positive, if you are in close contact with someone who tests positive, and the CDC has recently updated this to defining close contact as within 6 feet of someone for 15 minutes. This doesn't have to be 15 consecutive minutes. It just has to be 15 cumulative minutes with someone who tests positive. And then lastly, if you're recommended by a healthcare provider or your local or state health department, it's important to go seek out COVID testing. If I get COVID-19, do I have increased risk of severe disease during pregnancy? Recent data from the CDC has demonstrated that pregnant women have increased risk of hospitalization, ICU admissions, increased risk of mechanical ventilation, and their most recent data showed an increased risk of mortality in pregnant women compared to non-pregnant women. It's important to note, however, that the absolute risks for severe outcomes in women in pregnancy who get COVID-19 are low, but we do know that there is increased risk compared to those who aren't pregnant. The CDC's most recent data that was released at the end of October found that on approximately 23,000 symptomatic pregnant women with COVID-19, they found that there was a threefold increased risk of ICU admission, a almost threefold increased risk in mechanical ventilation, and the risk of maternal mortality was 1.7 times increase compared to non-pregnant women. Again, as I said, it's important to note that the overall absolute numbers of this, however, are low. Those women who were at greatest risk were pregnant women between the ages of 35 and 44 years old. They were found to have nearly 4 times increased likelihood of needing mechanical ventilation and 2 times increased risk of dying from COVID-19 compared to non-pregnant women at the same age. And then similarly to the general population, Black and Hispanic individuals who are pregnant appear to have disproportionate rates of COVID-19 infection, as well as death rates, demonstrating increased disparity in rates of infection. Additionally, pregnant women with comorbidities such as obesity or gestational diabetes may be at an even higher risk of severe disease, consistent with what we see in the general population, increased risk of disease in people who have other complications such as hypertension, diabetes, and obesity. It is really important to note, however, that this data out of the CDC is limited because many of the total reported cases, pregnancy data was missing on a significant number, as well as the reason for hospitalization. It's hard for us to know if this increased risk of hospitalization and ICU admission was associated with COVID-19 infections, or if this was associated with other pregnancy-related complications. Their most recent data, however, focused only on women who had symptoms and positive COVID-19 rather than their previous data that took all women into account. So based on the data that we continue to gather, although pregnant women don't have increased susceptibility of developing COVID-19, they do have increased risk of disease severity and have now been classified as an increased risk population by the CDC. Now that we've talked about the risk to mom, what about risk to your baby? We know that everyone's really concerned about what are the risks of COVID-19 to their baby. The good news is that there's very limited data on in utero transmission of COVID-19 to the fetus. There have only been 2 well-documented cases of the potential of in utero transmission, or what we call congenital infections, suggesting that the risk of babies being infected in utero is unlikely. And there have been cases reported of babies testing positive for COVID-19, but these most often occur in women who had infections within 7 to 14 days prior to delivery. The CDC reports a 2.6% risk of perinatal infection, or infections around the time of delivery, in women who were sick within a week of their delivery. However, good news shows that there was no difference in adverse outcome, including preterm birth, admission to the neonatal ICU, and respiratory disease found between those babies born to mothers testing positive for COVID-19 and those who tested negative. The majority of our data so far in this pandemic comes from 3rd trimester pregnancies. So we continue to gather information about what happens to women who develop infections in their 1st or 2nd trimester and recover, and the pregnancy continues. Studies to date have shown that there's an increased risk of preterm delivery in women affected by COVID-19, with a preterm delivery rate of approximately 12%. The national preterm delivery rate for all pregnant women is approximately 10%. So this rate is higher than that. We think that this is somewhat related to concerns of moms who are ill around the time of delivery getting sicker, and recommendations for earlier delivery to help improve maternal outcomes. In terms of other respiratory infections and how it's affected babies, we've seen in other respiratory infections increased risk of having babies that are smaller than average. And because of that, we are recommending some additional ultrasounds in the 3rd trimester for women who have a history of COVID-19 during their pregnancy to make sure that their baby continues to grow appropriately. Additionally, as we heard in the last talk, we know that there's risks of infants contracting COVID-19 as well. So it's important that once the baby's arrived, if you've recently tested positive, or if you have family members who are positive, that you continue to take precautions to ensure that baby doesn't get sick. And this includes wearing masks, washing your chest and abdomen prior to handling the baby, and all the things that we can do to help reduce those risks. So speaking of risk reduction, what can you do to reduce your risk of getting COVID-19? Unfortunately, at this time, there isn't a specific treatment, medication, or vaccine that can reduce your risk of getting COVID-19, but there are several things that you can do to reduce your risk, and this is the same things that we've been hearing for months that everyone can do. These include wearing a face mask when you're in public. We know that the risk of transmission if one person is wearing a face mask is significantly reduced if one person has COVID and they have a mask and the other is wearing a mask as well. If both people are wearing masks, that risk of transmission of COVID-19 is significantly reduced. Cleaning surfaces regularly and not spending too much time in public further reduces your risk. Washing your hands often with soap and water or using hand sanitizer with approximately 60 to 90% alcohol helps reduce your risk. And if you do need to be out and about, keeping at least 6 feet of distance or greater from you and someone else. In order to minimize our risk of acquiring COVID-19 infections, pregnant women should limit unnecessary interactions with people who might have been exposed to or are infected with COVID-19, and this includes those within your household. If someone at home tests positive and you're pregnant, it's important to try to have that person isolate as much as possible to help reduce your risk. When going out and interacting with others, as we said, masking, social distancing, and hand hygiene is really important. We'll talk about some other things to help reduce your risk here in a second. Some special populations that I know can be challenging while you're pregnant include pregnant mothers who have young children. COVID-19 in children under the age of 10 is often mild and asymptomatic, and given the possibility of transmission from asymptomatic or pre-symptomatic individuals, the CDC currently recommends limiting in-person playtime with children from other households that you're not potting with or not living in the same household, and advises parents to take protective measures to help protect their children with their when they play with children from other households, such as wearing masks. And then another question that I typically get has to do with pregnant women and working. According to our most recent recommendations from the American College of Obstetrics and Gynecology, pregnant women can continue to work until delivery. However, employers should work with pregnant women to make accommodations as needed. Pregnant women should be provided the ability to occupy roles which reduce their risk of getting COVID-19, which includes the ability to work virtually if possible. They should be able to have employers that follow current CDC guidance and direction from state and local health departments. And preventive practices that we've already discussed need to be in place in order to ensure the safety of all employees. So what are some other things other than what we've always heard on the news recently as far as social distancing and masking that you can do to reduce your risk of getting COVID-19? Attend your prenatal appointments. Prenatal appointments may look different or may have looked different earlier this year and may still look different in that we're employing more telehealth visits. Telehealth visits allow you the opportunity to meet with your provider, but not venture out to be surrounded by other people and increase your risk of exposure. But it is really important, especially for women who have high-risk conditions, that you continue to attend appointments and ultrasounds. That allows us to pick up on things besides COVID-19 and ensure that you're having a healthy pregnancy. Additionally, getting a seasonal influenza vaccine can help reduce your risk of getting COVID-19. Not specifically reducing your risk of getting COVID-19, because we know that the flu and COVID-19 are two separate viruses. But if we do know that there are cases of people co-infected with both. And if we can reduce the risk of getting one of those, that will help ensure your health and help to at least eliminate one potential cause of an illness if you get sick. So what are we doing to keep you safe at your appointments and at the hospital? At Vanderbilt, all staff and patient visitors are screened on entry to the clinics as well as the hospital. All staff and patient visitors are having temperature checks daily, and all staff and visitor patients are asked to wear a mask the entire time that they are on campus. Rooms are cleaned after each visit. Public areas are cleaned multiple times per day, and public areas have been restructured to allow people to stay at least 6 feet apart. You and your family's safety and health are of paramount importance to us. And so this is what we are doing as clinicians and the clinics and the hospitals to keep you and your loved ones safe. It's important to know that the hospital remains a safe place and not to avoid seeking care because you are concerned about the risks of COVID-19. So what can you expect at the hospital when you give birth? As I've said throughout the talk, COVID-19 has created many challenges. However, we don't want that to diminish from this exciting and special time for you and your family. And we're doing everything we can to keep you safe. Policies are subject to change depending on the current COVID situation. So it's really important to continue to look at the guidelines for your specific hospital or area that you're planning to deliver at. These are the current guidelines that we have in place at Vanderbilt to protect you, your family, and your healthcare team. Temperature and symptom screening at entry to the hospital. We're doing COVID-19 testing on all patients admitted to the hospital. If you have a scheduled C-section or induction, we're asking that you complete that prior to the date that you're scheduled to come into the hospital. Masks are asked to be worn throughout your hospitalization, except for when you're in your room by yourself. You're allowed one support person throughout your hospitalization, and that does need to be the same support person to reduce exposures to you and to the baby. You can have a professional doula that can be present during labor and delivery. And except in rare cases, infants will stay with mother post-delivery, except in circumstances when we're not able to do that. We understand that wearing a mask during labor can be difficult. I will say most women have said that it hasn't been as challenging as they initially thought, but if you have concerns, be certain to discuss that with your obstetrical provider. I want to turn now to your questions. I have some that are questions that people have brought up regarding things in the past. I was just going to look here in the chat and see if there's anything to ask about here. The question that I see here is any studies on postpartum depression during COVID if it is statistically higher during this time and the normal amount prior to the pandemic. There actually has been a lot of research, and that's one of the questions that I have in here as well, is how do we handle stress, anxiety, and depression during such a unique time in our country and in our lives? We have found that there is increased risk of depression and anxiety amongst our patients, and have been discussing various resources to refer patients or ways that we can help reduce stress. I know for a lot of my patients, trying to figure out something that they enjoy, whether that's exercising, doing yoga, getting some time outside, meditation. I know a lot of people that have started meditating. Apps like 10% Happier and what's the other one? I totally just blanked on that. But there's two kind of wellness apps that are available. Calm is also free right now during the pandemic. And so lots of options available to help reduce stress. Additionally, for people who are concerned about going out and having, if they desire to seek additional care from behavioral health specialists, a lot of them are offering telehealth options as well as options via the internet that you can find a counselor to discuss things. But we very much understand that this is stressful times, especially in the setting of a pregnancy, and that the need for additional support for behavioral health and emotional support is really important. A couple other questions that people have asked is, how are you handling kind of family during the holidays coming up, as well as in the hospital? I think in terms of the hospital, it's really important to let people know that these aren't your rules. These are the hospital rules in order to keep everyone safe. And unfortunately, you are only allowed to have one person, and that you'll celebrate when you're able to, using FaceTime and things like that are helpful. I will say here in Nashville and at Vanderbilt, we haven't reduced your time in the hospital. As far as postpartum, you are able to stay longer if you, or the normal amount of time that we typically do, which is 2 days after a vaginal delivery and 3 days after a C-section. I know I'm kind of running short on time, so I'll wait and see if there's any other questions. But I really want to thank everyone for the opportunity to talk today. We know that these are unsettling times, and if there's anything that we can help with, I'm always more than happy to be available. So thank you guys so much for the opportunity.